Welcome to Dentists Behaving Badly. I'm Dr. Toni, a dentist who has been in practice for over 20 years. I'm selecting articles from the internet of instances of dentists who have made the news for acting up and others who have found themselves in bad situations. Sometimes good intentions turn into something bad, other times the intentions were bad from the beginning. The link to the source article for today's story can be found in the description box. Also, I'm not trying to embarrass anyone, so I only use the initials of the accused in the video. The identity of the accused can be found in the source article, which is in the description box. Today's story was found on WYFF 4 out of Greenville, South Carolina on May 6, 2019. Greenville pediatric dentist accused of illegally dispensing opiate and other drugs. A pediatric dentist in Greenville is accused of giving out drugs without prescriptions, including an opiate to people who were not patients, arrest warrants say. The doctor of a pediatric dentist in Greenville was arrested Friday and charged with several counts of illegally distributing drugs. The arrest warrants say from May 2nd to December 4th of 2018, the dentist dispensed hydrocodone, an opiate used for severe pain, halcyon, a benzodiazepine commonly used to treat insomnia, and diazzapam, a benzodiazepine typically used to treat anxiety or alcohol withdrawal. According to arrests, the dentist dispensed the following drugs on the listed dates: December 3rd, 2018, halcyon; December 4th, 2018, halcyon; May 2nd, 2018, hydrocodone; May 3rd, 2018, hydrocodone; May 22nd, 2018, hydrocodone; June 15th, 2018, halcyon; June 18th, 2018, hydrocodone; June 15th, 2018, diazzapam; June 21st, 2018, hydrocodone; June 28th, 2018, diazzapam; July 9th, 2018, hydrocodone. The arrest warrants say the dentist acknowledged that he had authorized prescriptions for the drugs for people who had no patient history or records. All three drugs are known to cause addiction, sometimes within a couple of weeks, so they are only generally prescribed for short-term use. The dentist attorney released a statement on behalf of his client saying, quote, "I apologize to the families of my patients as well as my friends, family, and associates for mistakes I have made in my practice. The charges I face relate to prescriptions written for friends undergoing medical treatments. It was never my intent to do anything wrong or break the law. I have already taken steps to address shortcomings in my record keeping and practices identified by DHEC." This dentist definitely raised a red flag with his prescribing habits. It's against the law for doctors to write prescriptions for people who are not patients of record, and also it's against the law for doctors to write prescriptions for ailments that are not in the scope of their respective practice. For example, a dentist should not write prescriptions for blood pressure medication. There was a time when the authorities were not as strict and doctors had more leeway with this, but it changed with the opioid epidemic. However, my sympathy is with the dentist in this case. It's not uncommon for family and friends to ask for random prescriptions. My husband once asked me to write a prescription for one of his friends who had a persistent cough. I refused. I told him he needed to stop playing with me. If his friend had enough time and money to run the streets with him, doing whatever, playing golf, having drinks, he had enough time and money to take himself down to the CVS Minute Clinic and get some antibiotics or get his persistent cough treated. So you have to, as doctors, be very, very conscious and very, very stern and protect your reputation, your license, your ability to prescribe. I know that our family and friends don't think about it like this and they don't think that they're doing any harm, but this prescribing medications that you are not supposed to, or prescribing medications to people who are not patients of record, or for, like I said, ailments that are not in the scope of your practice, is against the law and can be harmful to your reputation. Most dentists endeavor daily to use their skills, talents, and social standing as doctors to provide outstanding care to their patients and serve as role models in the community. A small group of others allow entitlement, greed, and personal proclivities to overshadow their responsibility to their patients, the profession, and society.